So a sexually active woman could end up with cervical cancer, and a woman that's not sexually active, chances of getting it are very low.
That's exactly true. Chances are very low, yes, very, very much so. And that is what, you know, going back to your question about how we're prolonging lives now. You know, say, for instance, a woman comes in and gets her pap smear, and then it dictates some kind of abnormality, you know, call it dysplasia. So when it picks up that pap smear that early and there is dysplasia, you can actually offer a treatment, you know, maybe just surgically removing a bit of the cervix, or freezing the cervix, and so on and so forth. There's a wide variety of treatments you can offer to nip it in the bud that early stage. Now, if a woman spends 2, 3, 4, 5 years and never seen a gynecologist and has a cervical dysplasia going on, that can actually advance the cervical cancer. And by the time this woman shows up, she already has cervical cancer, and God forbid, advanced stage of cervical cancer could be deadly. What
are some of the symptoms for cervical cancer?
He will be.
Yeah, most of the time it's going to be abnormal bleeding. You know, somehow.
Abdominal bleeding.
Abnormal bleeding that is not normal, and there's something that's also called postcoital bleeding. Those are also types of abnormal bleeding. Postcoital bleeding is, say, for instance, after sex they start having bleeding. You know, so something. This is at the early stages of cervical cancer. That is what would prompt them to come to the doctor. I'm bleeding each time I have a relationship. And then we do an exam and, you know, get biopsies of the cervix and say, this is cervical cancer.
So if a woman is bleeding after sex, she should go to see a doctor?
Absolutely. That is one of the reasons that they should come. And of course, it shouldn't be only when they bleed after sex. Just like we pointed out, they should come regularly to see their doctor, because sometimes, like I said, they might not even have bleeding. You know, they might think that they're normal until we do that pap smear and notice there are abnormal cells.
So basically, at Women's Health Institute of Macon, you suggest that women at least see a gynecologist once a year, starting at what age?
I would say starting as soon as they're sexually active. Yeah, so it could you know, depend on how soon they start being sexually active. But even if they're not sexually active, you know, it's not all about cervical cancer. You know, gynecology. They could also be having other problems like abnormal bleeding, abnormal menstrual cycles, and pain during menses, and so on and so forth.
So I'm changing what you said around just a little bit. Men give women cervical cancer.
Yes, I don't.
Not. I mean, it's not like it's a disease or something, but the activity during sexual intercourse can give women cervical cancer.
Exactly, because you see, the virus that causes it is not something you know one sees. You know, a lot of men could be harboring that virus and not even know it. So it's not like, you know, for the men out there, I'm not trying to hate a man. It's not like they know they have it and they're intentionally giving it out. You know, it's the same virus, like I said, you know, it's a different strain of the virus that causes what. So some men might carry it and not even know, and that's how it spreads.
Yeah, that's something. So a man could be carrying this virus around, and when he goes to the doctor, the doctor don't even detect it from him.
Exactly, because as far as I know, there is no way for screening men to see if they are carriers of this human papilloma virus.
Maybe somebody would come up with a way to screen men rather than them passing it on to women. Because if they have it, and they don't know it,
right. Exactly.
It's not just like a STP.
Exactly. Yes.
But you're passing it on to somebody, and they end up with cervical cancer, which could take them out of here.
Yep.
Okay.
Yes, indeed.
My last question to you. You talked about my forehead had wrinkles on them and stuff. So I might need some Botox treatment. So you can get rid of those wrinkles.
Yes, we can. Yes, make your face beautiful.
How long does it take to get rid of those lines that you? So wonderfully acknowledged on my head.
Well, with Botox, I mean, you can start to see results between 3 to 5 days, and it lasts about 3 months. So you need to see me every 3 months if you want to look pretty.
Every 3 months.
He already looks pretty. What are you talking
No,
about?
but I'm just saying how so you get Botox, you don't get it once. You come back in 3 months because what, it dissolves or disappears or what?
Well, that's how long it lasts, you know, on your skin. That's how long. Some people last up to like 4 months, but you know, if you want to keep looking the same like the Hollywood stars, then you need to get it every 3 to 4 months.
So you can get it from your nose going down, you know, the little wrinkle.
There's a way we do it, you know. There's a way we do it. We have landmarks that we use, and
As the size of injection.
exactly at the sites of injection.
Oh, you inject Botox in your skin?
Yes, I do. You do, yeah.
Okay, very interesting. I appreciate you taking the time for me. Women Health Institute of Macon. Welcome to Macon, and anything else you need to say? Where are you located?
We're located at 840 Pine Street, Suite 900 at the Medical Center. And our website is www.womenshealthmacon.com. And I was just going to point out a few more things. One of the things that make us unique here is that a lot of services that we offer are what most people might have to go to the operating room for. Say, for instance, we can stop a woman from having heavy menses, heavy bleeding that control their life. We do that right here in the office. No IV. You know, we make the woman comfortable. We do it. They go home same day. We do things like sterilization, tying a woman's, you know, blocking a woman's tube. You know, somebody that is done with childbirth doesn't have to go to the operating room to have that done. We do it right here in the office. So we do offer quite a bit of in-office procedures that before used to be somebody has to miss work and, you know, come to the operating room and go under anesthesia. The technology has improved so much now that we offer those in the office the same day visit, and they may just miss half a day of work or just 1 day of work and go back to work the very next day.
I appreciate it. Let me ask you this, a personal question. When a doctor's married to a doctor, when they go home, do they talk shop?
No.
That's how Women's Health Institute came into fruition. Actually, that's when we talked shop. Yeah,
we talked.
how,
yes, yeah, we talked. You know, her background and my background, and we started thinking, you know, why don't we pull our resources together and dedicate our services to women, where a woman would just come in, and the name says it all, Women's Health Institute. So whatever bothers a woman, you come here, chances are that we'll take care of it for you.
Well, I appreciate you spending the time with me.
Thank you so much.
And we need to come back again. You have an open house? When is the open house?
Yes, the open house is this March, the 22nd through the 24th, and it's going to be from 7 a.m. to 5 p.m. So
7:30.
7:30 a.m. to 5 p.m. So it's going to be all week event. So come visit us.
And you tell them about the giveaways we have.
Oh yeah, we do have quite some giveaways. We have a free iPad. You know, but that will be through raffle draws, and we have skincare products that we're giving away. We have a lot of information, especially on the weight management, and
Now, I've been told I'm a little heavy. What do you do to manage a woman's weight?
well, we do offer low glycemic index way of eating. Okay, we actually monitor you. We do nutritional supplementation. We do group support. We do journaling. You know, and I mean, and I'm also here to kind of train you and educate you on what to eat.
We're going to have to come back and talk about that some other time. You could tell me what to eat. I like that. I hope it's good.
It sure is good.
Well, I appreciate the two of you, and congratulations for the Women's Health Institute of Macon.
Thank you so much for coming. We appreciate it.
And we will be right back.